Now I'm gonna turn, we're gonna move on and give the mic again to Dr. Joe Heyman from UT El Paso. He's gonna talk about the everyday border crossing, including health services. Again, he's the director of the Center for Inter-American and Border Studies at UT El Paso and co-organizer of this webinar. Adelante, Joe.
Thank you all very much. I'm going to put up a presentation, and the point of this presentation is to see the typical pattern from about a year and a half ago of border crossing, and what that's going to do is give us a sense of the baseline of normal border crossing when the illness takes hold, both the public policies that limit border crossing to essential crossing, the economic impacts, and also the shift to stay-at-home behavior, which is the right thing to do, but it clearly impacts border crossing. And I want to emphasize that this is not current data. We do have some good journalistic reports from the border, and we've got some anecdotal information, but obviously this is unfolding much too quickly for us to have systematic research data. So I'm drawing on a survey of citizen perception of the two sides of the border that includes border crossing, and I want to quickly just show you all of the various organizations that help put this research project together. I want to thank my collaborator, Eva Moya, and the funding organizations, the El Paso Community Foundation and the Fundación Comunitaria de la Frontera Norte in Juarez. And this is a little bit of the technical stuff about the survey, just to tell you it was done in both countries. It was a random sample, and the numbers of surveys that were done in the two countries were large enough to have a pretty low margin of statistical error. So the first thing that we found is that the majority of people, well over the majority, 50%, 62.8% of people surveyed in El Paso crossed within the past 2 years to Ciudad Juarez. This was in 2018. And 25%, a quarter of the population surveyed in Juarez, crossed to El Paso. That's consistent with what we know because many people in Juarez don't have a visa and can't cross as much. But still, we're talking about large numbers of border people on both sides are directly crossing. And this doesn't even count the number of people who are affected by crossing processes such as employment in the maquiladoras. People cross pretty frequently. These are numbers. I won't read all the details off the slide, but you can see that people are crossing with considerable frequency, weekly, monthly, and so forth in both countries. And this chart shows us that a number of important reasons. So when border crossing slows down, it's going to impact visiting family and friends, so it's going to have a social and cultural impact. It's going to impact commerce, things that Dr. Fullerton mentioned, shopping, entertainment, and it's going to impact accessing health services. Now, accessing health is considered to be an essential reason for crossing the border, but in practice, there are probably more barriers. Border officers are going to ask more, and people may assume that they can't cross. And at this point, I should also mention that it's my understanding from initial journalistic reports that the U.S. government is not accepting the border crossing card, the pasaporte local, for crossing the border. And people know about that, they can chime in, but that will impact a large number of people going from Mexico to the United States for these various reasons. Focus in here on the reasons for crossing to Juarez, where Medical reasons are very important because this is likely to have a significant impact on healthcare, even though it's treated as an essential reason for crossing. These are reasons for crossing to for Juarenses crossing to El Paso, shopping, visiting family and friends. So that's going to have an impact on the local economy in El Paso. Border crossing doesn't make up as large a part of the El Paso economy as most people assume, but it's still pretty significant, and Dr. Fullerton can talk about this. Another thing which I think really gets at the extent to which people on the border are interconnected with each other is that a significant number of people in El Paso say that they have homes in Juarez or in both cities, not only El Paso. A much smaller number in Juarez, but not a trivial number. So there's a lot of people who are truly binational. They may have family on both sides of the border. Here's the evidence of the number of people who have close family members. We have a lot of detailed exactly who they are, but this gives you the big picture. Close to 2/3 of the population in each case has close family members on the other side of the border. And a fair number of the people, especially on the U.S. side of the border, report not having health insurance. The number is smaller in Juarez, but it's significant there also. So the truth of the matter is that the two countries serve as medical safety nets for each other. And people go back and forth. You can see the reasons that they use the other side of the border to take care of their health care. The single largest way that people take care of their health care in El Paso was a private doctor or clinic in Juarez. So, and this gives a little bit more evidence about the use of health care. So if you have questions about this, you can send questions via the question and answer box, or you can send me an email. There's my email, and thank you very much to the audience and presenters.
Thank you, Joe, for such an interesting presentation. Again, I think re-emphasizing the fact of the interdependence across the border, Juarez in El Paso, and that echoes, I think, what the former presentation said to the overall economic, social, and human connection between Texas and Mexico.